The number one challenge to delivering whole person care to people in the United States is the fact that we don't have a healthcare system. We have a healthcare marketplace. And if you look at what gets done in the US healthcare system, you don't have to look far to find out that it's what gets paid for. What gets paid for gets done. So even if a patient may need to have a 45-minute or hour-long conversation with their doctor about what's happening and what their options are and what the pros and cons of the options are and what they can expect in the future, that doctor is not getting paid for that 45-minute or hour-long conversation, and most of the time it doesn't happen as a result. So I would say reasons 1 through 9 that we don't have whole person care in this country is because of the way we design the system to be driven by what gets paid for. So a lot of what gets paid for gets done. And what doesn't get paid for doesn't get done at all, even though arguably many of the things that don't get paid for are at least as important, if not more important, than the things that do get paid for. So that's reasons 1 through 9. Reason 10 is that we train doctors and nurses opposite to the principles of whole person care. We train doctors and nurses to subspecialize. So most young physicians are exposed only to specialists in medical school and residency. And they think that even though when they went to medical school they thought, oh, I'd like to be a family doctor, I'd like to be a primary doctor, the people they see in practice when they're training in their sort of apprenticeship phase are subspecialists. Cardiologists who focus only on heart failure, or cardiologists who focus only on coronary artery disease, or cardiologists who focus only on rhythm problems with the heart, or cardiologists who focus only on surgery of the heart. I mean, there's like multiple subspecialties even within the subspecialty of cardiology. And so something like 90% of young physicians end up subspecializing. And if your training says to you, your job is to focus narrowly and deeply on one slice of this patient, on one slice of this person, and in fact your job is not to focus on all the other things that patient and family are dealing with, whether it's depression or financial challenges or anxiety or pain, it shouldn't surprise us that doctors don't address those things because they're trained not to address those things. They're trained to focus very narrowly on one specific area of subspecialization. And that would be fine if there was also a primary care doctor in the mix who was paying attention to the whole person. But a lot of the time, patients with complex chronic or serious illnesses see a lot of subspecialists and they don't have a quarterback. They don't have one person who's managing the whole system. And this is the way we train young people, so we shouldn't be surprised that this is what we're getting. So I would say that's the 10th reason why it's so challenging and so difficult to get whole person care. The first 9 reasons being it's how we pay for care that prevents that from happening. And the 10th reason, and this is linked to how we pay for care, that we train doctors to deliver very fragmented subspecialty care, and that's exactly what we're getting.